In this Your Healthy Family, my stories usually tell you things to do or not to do, especially during the holidays. Don't overeat. Make sure and exercise. Get a healthy amount of sleep. Well, this story isn't so much about trying to tell you what to do, but to make sure you understand exactly what's happening in our community and that what you do plays a role in that.
So how long have you been caring for COVID patients?
We've had COVID patients since all of this started back in the March timeframe. COVID has never gone away for us here at the hospital.
Lisa Simmons is a registered ICU nurse at Memorial Hospital who continues to care for COVID patients.
We're tired. Our numbers have skyrocketed. So for us, it almost feels disheartening because we're doing everything we possibly can to care for these patients, and just more and more keep coming in. We are all worn down. We're emotionally worn down, and it's been tough.
Lisa has seen COVID-19 affect a wide range of patients.
And obviously, those that are at high risk are with the ones with pre-existing conditions such as COPD, asthma, heart disease, but we are seeing patients who are young in their 20s and 30s with no pre-existing conditions, healthy, had just worked out several days prior, no symptoms, coming in and dying from COVID. We may have put them on the ventilator trying to help save them, and unfortunately, not everyone is making it through that.
What's her advice heading into Thanksgiving? Keep it in the household.
I recommend do not go to Thanksgiving with your family. I've canceled my own family Thanksgiving plans. My mom is high risk, and I would not be able to live with myself if I was a carrier and didn't know it and gave her COVID. It would absolutely kill her. Please wear your mask. Please social distance. Try to just stay within your own household for Thanksgiving this year. Don't go and see extended family, especially if they're elderly or you're not seeing them often, because we are feeling the brunt of it, and we're still doing everything we can to help save our COVID patients and all of our patients.
Okay, maybe I stay away from that family gathering, or I wear a mask, or I social distance. Will it really make a difference as to what the hospitals are seeing? I think that's what a lot of people might think.
It will absolutely make a difference for us. You may think it may not happen to your family, but we actually have families who have multiple family members here with us. We have husbands and wives on ventilators in rooms right next to each other. And it is so isolating to be a COVID patient in our hospital right now. We only allow one visitor to come in, look through a clear glass door for the rooms that have that in the ICU to, just visually look at their loved one. But our patients can't have visitors if they're positive for COVID. We're trying to do the best we can to be that human connection with our patients. And I think if you don't think it's going to happen to your loved one, just think, what would it feel like to be in that bed, not having anyone who can come visit you, struggling to breathe, being maxed out on your oxygen amounts that we can give you, and not knowing if this is the end for you.
I'm always watching out for your health. I'm Ira Cronin.